Hey, what's up, Sports Rehab Expert world? Today we're back at it with another episode of the Sports Rehab Expert Success Show. This is Friday, it's end of the week, so happy Friday. Hope you all have a nice weekend planned ahead. I'm going to be heading up north in Michigan to Grand Rapids area, meeting up with some buddies that I went to school with. One in particular who I ran track with in college. We always like to get together, have a hockey weekend where we go watch a hockey game. So usually I went to school in Findlay, Ohio. So we usually we're meeting up in Ohio, but this year we're meeting in Grand Rapids, Michigan area, watching the Griffins play for the weekend. So that's what I'm up to. Hope you all have some nice plans as well too, and had a nice week in the clinic as well. I just got done treating today, and the last case of the day was a new patient, and it's kind of a little bit of an intriguing one, interesting case. So just wanted to share it with you and share my experiences. So hopefully you can get something out of it. I think this one's going to provide a nice reminder for everybody, and that reminder is that if you're dealing with some type of distal extremity issue, to always be clearing something proximal in the spine. And what I mean by that is this patient presented to me today. He searched me out for dry needling purposes due to a tricep weakness or a tricep problem, having some tricep pain associated with any type of pressing movement. So like a bench press or a push-up or even holding a plank with the elbows extended, you notice that he fatigued out a lot. Now this was a really fit individual, someone who's really strong, normally is able to do like 80, 90 pound dumbbells on the press, but now 50 pounds is fatiguing him out significantly. And if he does a barbell overhead press, he said, at a pretty light weight, he would notice that he's really deviating to the side, and his right arm isn't able to press up overhead and keep the bar even or keep the bar level. So thought it was a tricep, and I mean that obvious. Don't blame him for that assumption either. And we did some testing. We ruled out red flags first just to make sure there's nothing else significant kind of going on. But then I asked him, he was dealing with this issue with the tricep weakness for about 2 weeks. And he described that tricep weakness more as like a numbness about the tricep, not so much as like a paresthesia or numbness tingling, but as fact that he just couldn't activate or use the tricep with full strength like he normally would be capable of doing. So he never had any bout of radicular pain or anything like that. And again, the discomfort that he has is more of just like a quick fatigue in the tricep, and the tricep just not feeling like it's capable of activating or pushing as much weight as he's used to. So I asked him during the evaluation, have you recently had any type of neck issues? And he's like, yeah, as a matter of fact, the right side of my neck has been pretty stiff for the past month, kind of stemming from a workout where he felt things kind of cramp up, seize up, lock up, related it to, if you wake up in the morning with a stiff neck. Said, he's been constantly trying to move his neck. The neck range of motion's been improving, but he still feels a little stiffness, tightness there in the lower cervical, upper thoracic region on the right-hand side. I asked him to point to it. He pointed right to C6, C7 area. So obviously that intrigued me, being the tricep C6, C7 innervation. So we dove into that much deeper. Obviously, you'd go through your standard neuro evaluation. His reflexes were fine. There wasn't any paresthesia, numbness, tingling, so it wasn't anything that I worried about from that standpoint. Manual muscle testing wise, he was still pretty strong in the triceps. Again, relatively speaking, for manual muscle testing of the triceps, we tried a lot of different positions like the overhead pressing, overhead tricep at 90 degrees of flexion, and tricep push down. And again, manual muscle testing wise, he was pretty strong, and it was hard to see a huge difference side to side. But obviously when you get into the weight room and you had him push more significant weight, there was a pretty significant difference there as far as what he was reporting as overhead pressing, bench pressing being from what he was normally capable of doing. So some weakness that was definitely there, but on the manual muscle test, it just didn't seem like anything too significant being there. So if you didn't ask about a full history, you wouldn't know these type of things. But being that the individual was really big into fitness, he's going to bring these things up as we talk about it. But no excuse not to rule out red flags, so always make sure you do that. But then again, when you're dealing with some type of distal issue or muscle weakness or any type of pain distally for that matter, you always do want to question about something proximally. In this case, the proximal spine consideration would be the neck. And if we didn't do the due diligence of asking him those questions, it never would have led us to the area that we ended up starting treatment with. So when I checked his cervical range of motion, his cervical flexion was fine, chin all the way to chest. Cervical rotation full in both directions. Cervical rotation plus flexion was full, able to drop the chin to collarbone, kind of the classic SFMA cervical test you would do there. Full, no pain, no stiffness, no tightness. Side bending, same thing. Felt relative stiffness both sides, but range of motions were symmetrical and within normal limits. Now cervical extension was full, but painful. So he was able to get all the way back, but the last 10 degrees or so were stiff, tight, and in pain. Something that he'd say he wouldn't want to do repetitively. Cervical retraction was also fine, no limitation noted there. So one cool test that you can do with this, and it's something I like to do a lot with true disc herniations or any type of radicular symptom or even any neck mechanical muscular tension pain, is just kind of rule out what do you think is more involved with their limitation and how they move their neck. Is it more muscle related, or is it more joint related or disc related? One simple way of doing that is to take the upper traps out of the equation. So typically when you're sitting, if you are there's going to be tension on the upper traps. So the upper traps are tensioning downwards due to gravity. So what you have them do is you have them just kind of cross their arms, rest their hands on their shoulders, and you come up from behind them and kind of lift their elbows up and shrug their shoulders for them. You want them to think heavy arms, so they weight their arms heavily, and you take tension off of the upper trap and you slack the upper trap, and then you have them perform the cervical movement again. And in his case, pain went away with cervical extension. So then I showed him how you could do that at home, which is go to the wall, perform a wall slide with both arms straight up overhead, and you use the upward rotation of the scapula to your advantage to create that slacking effect. The wall creates it, makes it passively as you just hold the hands all the way up overhead, supported on the wall. So now the upper trap again is slacked, and you take tension off of the upper trap. By doing that, perform cervical extension again, full, pain-free. So that became his homework to do. 10 to 12 reps repetitiously throughout the day, at minimum 3 times a day. I told him, if you can get to it every other hour, that would be great. But until this becomes pain-free with your shoulders relaxed down, we needed to do this often to restore that range of motion. And then while he was doing that I also want him to continue doing some type of tricep press downs, just at the side at 90 degrees, more of like a skull crusher position. And then also just a light weight kind of going up overhead to keep some stimulus going to the tricep, to keep some relative strength and activation going to that muscle group as well. Because he really wasn't having pain with that unless he loaded it really heavily up, and it was more of a weakness issue that he was having than true pain with that movement either. So felt comfortable loading the triceps. So that was his home program. In treatment, we also got into dry needling of the upper traps, cervical multifidus around C6, C7, and then down into the infraspinatus and tricep as well too. That's all that we did for the first visit. Next time, as long as there's no soreness or anything excessive with the dry needling going on, we're going to pair some instrument-assisted soft tissue mobilization on the back end of after doing the dry needling. We'll obviously keep reassessing his cervical range of motion and doing anything there to prove cervical extension. But that's the pattern that I'm looking at right now to see if that correlates with improved tricep strengthening over the next week or so. So he's back in next week and we'll see how it goes. But just wanted to fill you in on this case. Thought it was interesting. We'll let you know how it plays out. But just as a nice reminder that if you are dealing with somebody who has distal symptoms, distal weakness, distal problems, to make sure you check something proximally that might be associated with it, and never forget how the two are connected to one another. So always important to look at things proximally, and always important to rule out red flags. Hope you learned something from this video. If you, nothing more, you took that cool upper trap, taking the slack off of it, or taking the tension off of it, putting slack on it, and how that can help you dictate whether it's a cervical, perhaps a joint or a disc issue versus a muscular tension issue. If nothing more, play around with that in the clinic. If you found this case useful, again, we got a lot of more information, a lot more cases very similar to it inside the Sports Rehab Expert members area. So be sure to check that out if you aren't already a member. We got a lot more case studies, a lot more interviews, a lot more assessments that are just like the one that we talked about today. And it's going to really help take your clinical knowledge, clinical experience, and development of Planet Cares to the next level. We also have a course that comes out every year with this membership now, and that's 4 credits for both physical therapists and athletic trainers in the United States. So you can take advantage of the continuing education credits that you can get for being on the course or as a member as well too. And those are sort of some of the cheapest continuing education credits that you'll ever find. So be sure to take a look at that membership if you haven't already. We'll be back at you soon with another episode. Until then, everybody take care and have a good one.